do want to thank the Drexel School of Public Health for opening their doors and for hosting us. And for a couple of words, I'd like to turn it over to our host, Dean Marla Gold.
Welcome. I am Dean of the Drexel University School of Public Health. I know a lot of you that are here. I get the uplifting thing of always getting up in front of diverse audiences and saying that I'm proud to be one of the few out lesbian deans in the United States of America, which don't hold back. And was sorry actually to hear that this particular part of the conference was left out. And so that's what we were just talking about. But at any rate, I'm on vacation this week, but I couldn't have my people in my house and not drop everything and come down. The wife and children send their regrets, but the 6-year-old is at drama camp as if she needs it at the Art and Theater this week. And you give her a stage and we probably wouldn't hear from our wonderful speakers. I would be remiss, in addition to welcoming you, not to comment that the Drexel University School of Public Health is one of the few schools to have an LGBT health program. Ted Fagel and Dr. Randy Sell are here, and many of you know Randy's work and Ted's work. Ted's really helped to put us on the map, and we hope to be doing more. But I joined Narit, who I've known for many, many years, too many, right, we have to admit, and many others here. We have some icons in the room. We're old enough to say that. To just say that it's about lifting one another up. It's about all being here together, and without one another, we never move forward at all. I am among the people actually where, the census was a thrill for about a second. It's not enough. A lot more needs to happen. I would also remind us, and then I will finish up though, that particularly when political luminaries come and speak, we cordon off things that are great for all our health. And as a public health expert, I will tell you that Michael Nutter's sweep of the pen that brought us the ban on secondhand smoke in the city of Philadelphia was, while maybe inconveniencing some of you, probably the single most positive thing for the health of our people and all people in the city of Philadelphia to happen in centuries. So I'm very grateful to him. I know he's not here now, that I do want to mention that. So again, welcome. I'll be here to hear the program. We're always thinking also about new ideas. And I'm happy to join you as Grand Marshal this year with the kids. So wave to the float as it goes by. What an honor. Thanks.
Now we'll get right to the program, and I'm going to try to speed this up because I'm really eager to hear from Rebecca, Ernest, and Rob. We're going to start with Rebecca. Rebecca is the director of the National Coalition for LGBT Health. It's a coalition of over 50 organizations that focus on research, policy, education, and training. They're actually the sponsor of LGBT Health Awareness Week, which is coincidentally this week. And she's going to be talking about how national healthcare reform addresses the LGBT community's concerns, and talk about some steps that public policymakers can take to improve the health outcomes of the LGBT community and women and sort of the rest of the diverse community that we care about tonight. So Rebecca, I'll turn it over to you.
Sure. So the coalition is a national group. We focus on one main area, which is LGBT health. And the way that works is going into places that are talking about health disparities and policy that talks about health and talking about LGBT issues. So what do health disparities look like for our community? What is the overlap, right? LGBT people of color, LGBT immigrants, what's happening in our communities? And then going into the LGBT movement and saying health is actually a social justice issue. Because while we focus on all the great things like the Employment Non-Discrimination Act and all those other issues, they don't often talk about health, and that's what we stand to do, is to bring those issues up. And the way that we do this is by working in Washington, D.C. around different parts of federal policy, and today I'm going to talk about healthcare reform. And I have 5 minutes, so I'm going to do this very quickly, and then I'd love to take questions after we're all done speaking. The way that I'm going to do this is talk about what we got and what we didn't get. And when you do LGBT health work, sometimes what you didn't get is actually the best thing possible. So 2 things we did not get that we are so happy to have not gotten There was no outright ban on any member of our community or on any procedures for any member of our community, and we were really, really scared about that. There was also no definition of family that occurred in the bill, and that's good for us because any definition of family is probably going to exclude our community. So we were very happy not to get those two hideous presents, kind of like the cardigans that my mother gets me every year. It's fine. It's okay. What we did get is really important. We got better access to healthcare, and frankly, for a community that tends to be shut out of healthcare, because a major way of getting healthcare in this country is either through employment or through marriage, two difficult things for us. We actually have better access now, and that's really important. We didn't get the public option, which is what we really, really wanted and would have actually had a better outcome for our community, but we still have increased access. We have a removal of the ban of pre-existing conditions, which is a huge issue for our community that has a higher rate of mental health and substance abuse issues, widespread discrimination against transgender and gender nonconforming people accessing any kind of insurance care, and a whole host of other issues. So that's a great win for us. We got more money to federally qualified health centers, and that's incredibly important. When folks don't have health insurance, that's where they turn for good care, and we know that a big boost to them is a big boost for our community. The other thing, two other things that we got is more money towards prevention efforts, which was amazing because prevention's really, really expensive, and we expected it to get cut a lot more than it did, but we still got a lot of that money in. And we also, and as a sex educator, this is kind of the nearest and dearest to my heart, we got the first federal funding stream that's dedicated to a sexuality education program, and that feels miraculous. And here's the bad stuff. We didn't get a fix on the domestic partnership benefit tax. We didn't get data collection around our community. And data collection is one of those things, and I apologize to Randy and Fred, but unless you are a researcher and you love data collection, it doesn't always seem that important. But when they don't ask you what your sexual orientation and gender identity is, you're invisible to the federal government. You're invisible to all governments. And what that means is that the money that follows there, programs that follow, representation on health panels, all of that's wiped away when we can't answer a basic question about what our sexual orientation and gender identity is and how that overlaps with the other disparities that we face. We also did not get a lift of the 5-year ban on people with papers who are immigrants in this country. We still have a 5-year ban going on there. Immigrants without papers have no way of buying into the public system, and that's a huge issue for our LGBT immigration and those of us who have immigrant families. And the two things that also kind of hurt me the most, we had a reinstatement of some abstinence-only money, which was taken away recently, and that makes me incredibly sad. And we also have, thank you, a furthering of restrictions on abortion care, which will continue to impact the LGBT community as well. But the most important thing for us to realize is that healthcare reform has actually only just begun. The bill was very fancy, the speech was very fancy, President Obama's 22 pens, it's all very lovely, but what actually happens now is what matters the most. And that doesn't just happen on the federal level. That happens when your state and when your city applies for money and you ask for LGBT to be included. That happens over and over again as regulations come out. And the coalition right now is working on a gigantic chart that I can send you that's going to be talking about what of this is federal implementation, what of this is state, and what of this is local, and how you can be getting involved. We're also going to be holding a conference in about 2 months for state-level LGBT advocates who want to come hear about some of the more nuanced parts of the bill and how they can impact this on the state level. And we were also asked, I'm going to say this really quickly because I'm sure I'm out of time, how people can drive for change. And I would say it's really important in health situations. Not everyone gets to go to a wonderful place like Mazzoni. And when you don't get to do that, you need to be asking your private practitioners to count you, to look at their forms, to make sure that you can say that you have a same-sex partner or that you have changed your name and that they have a marker that makes sense for you. It's important to speak up and to be out in those situations and to come to town hall meetings that are not just focused on the LGBT community, but that are focused on health in general, and to stand up and say, as the LGBT community, we face health disparities this is what this looks like. What are you doing in your everyday programs to improve the health of my community and my family? With that, I'm going to turn it over to Ernest.